Is retinol being banned in the UK? I'm Dr. Saleena Zimri. I'm a cosmetic and dermatology doctor of 15 years, and I'm going to explain what the new EU regulations are saying about our favourite cream, retinol. So just to break it down for you, the EU have passed new regulations to restrict the percentage of retinols available to buy over the counter. So, for example, creams on the body can be no more than 0.05%. And for the face will be 0.3%. So in terms of products, for example, I've just grabbed a few that we have in clinic. A 0.3 retinol from SkinCeuticals will remain to be okay. However, a retinol skin brightener 1% is going to be off limits now without a prescription. Products like tretinoin, which is a prescription-only retinol, will remain unchanged. So this is your strongest form and will still require a prescription from your prescribing doctor or nurse. So why are they doing this? Well, the EU are saying that we need to regulate the intake of vitamin A more closely, and that includes a ban on products containing retinol. Now, some would say this doesn't make sense given our biggest source of vitamin A actually comes from our diet. So fish, eggs, dairy, that's our biggest source of vitamin A. And the male recommended daily intake is 900 micrograms. The female recommended intake is 500 micrograms, and that's a recommended daily allowance. We know from research that there's very little evidence and very little absorption of vitamin A products through the skin into our system. So we're talking about small numbers. If you use retinol daily, you're looking at 1 microgram, if that would be absorbed, given the retinol is applied to such a small surface area in the first place. So 2 to 3% of your actual body surface area is being exposed to retinol on a daily basis if you were using retinol products on a daily basis. If we put it into perspective, a sweet potato contains 1,400 micrograms of your recommended daily allowance. So what we're getting from skincare is negligible in comparison. So then why the hysteria given it's barely absorbed systemically? Well, the EU Commission is saying that retinol can be open to abuse. It's causing problems with skin sensitivities, causing irritation, and can compromise the skin barrier. So they would prefer to regulate the products, and for anything more than 0.3% on the face, it would require a medical prescription. It's also worth noting that oral vitamin A and topical is avoided in ladies who are trying to get pregnant or are pregnant because it can lead to severe birth defects, especially the oral form of things like isotretinoin, which would be a treatment for things like acne. So the advice is to carry on using your retinol as you are currently, but in future there will be some more restrictions depending on the percentage that you would like, and that the current use of retinol is not harmful to you, and that if you have any questions, the industry will be given time to adapt to these new regulations, and they will have to roll this out over a slower period of time, and they've got 36 months to do that. The UK will be following the EU regulations, as there were some questions as to whether the UK would be involved with this, given we're not part of the EU anymore. However, we are going to follow with the same restrictions, unfortunately. So my personal opinion is that it's probably a little bit overkill. However, I can see the good and the bad points. Good points being that we can regulate things a bit more. You will need a prescription if you want something stronger, and I guess at least that way you've had a medical assessment and there is a good need for that percentage on your skin. Negative points are obviously it will be harder to get, comes with an expense, attaching that to a prescription. So in terms of ease of access, that will be a little bit harder now moving forward. Retinol's been used for years with little risk to absorption. So this might feel like a bit of overkill. However, that is now going to be law. Let me know what you think of these regulations, whether you agree, you disagree, or any other questions that you may have regarding retinol and its use.